Opioid awareness, saving lives with Narcan and fentanyl test kits. Every day, more than 150 people in the US die from opioid overdoses. The rise of fentanyl, a synthetic opioid 50 times stronger than heroin, has made overdoses even more dangerous, claiming the lives of many, including high school students. But there's something we can do about it.
Opioids are a class of drugs used to relieve pain by affecting the nervous system. They come from the opium poppy plant, with natural opioids like morphine and codeine, synthetic versions like fentanyl, and illegal opioids such as heroin are also part of this class. Opioids work by binding to specific receptors in the brain called opioid receptors. There are three main types. First one is mu receptors, and these are responsible for pain relief, euphoria, and they also contribute to physical dependence. The next receptor is kappa. They are involved in pain relief and sedation. And lastly, delta receptor, and they play a role in pain and mood regulation. Though opioids are effective for pain, they carry a high risk for dependence and misuse. An overdose happens when too much opioid is taken, causing severe breathing problems and lack of oxygen to the brain. Opioids bind to mu receptors in the brain stems, which control breathing. As opioid level rise, breathing stops or slows down. This leads to low oxygen, causing hypoxia, and without enough oxygen, the brainstem can't function properly, leading to unconsciousness or coma. If left untreated, this can cause respiratory failure, cardiac arrest, and ultimately death. Certain factors increase the risk of opioid overdose. High doses or long-term use, mixing opioids with other depressants, or a history of substance use disorder all elevate risk. A recent period of abstinence can also make someone more vulnerable. Chronic illnesses like respiratory or liver, kidney issues can worsen effects. Finally, using opioids alone increases the danger, as there's no one around to help in case of an overdose. Fentanyl is a synthetic opioid 50 to 100 times stronger than morphine, and it is used medically for severe pain. However, it's often found in counterfeit pills or mixed with heroin and cocaine, which raises the risk of accidental overdose. Fentanyl binds strongly to mu receptors, and even a tiny dose, less than 2 milligrams, can be lethal. It's hard to reverse, and illicit fentanyl is unpredictable. Risk factors include not knowing it's in other drugs, using illicit opioids without tolerance, or a delayed response to naloxone. And people with respiratory or cardiovascular issues are at higher risk.
So, what are fentanyl test strips? Fentanyl test strips are a way for people to test if any of the drugs they're taking contain any fentanyl. The big thing to note with these test strips is that it only tells you if fentanyl is present or not. It doesn't tell you how much fentanyl there is. It's also possible to get a false positive, as these test strips can react to methamphetamine, NMDA, MDA, and diphenhydramine, also known as Benadryl. In order for you to test the drugs that you're taking, you're going to have to dissolve it in water. So taking a tablet or a powdered form, you're going to have to let it dissolve and mix into the water until it's an even solution. Once it is an even solution, you're going to put your test strip in for about 15 seconds and let it absorb. After that 15 seconds, you're going to take it out of the water and you're going to put it on a flat surface for about 2 minutes. After the 2 minutes, you can look for your results. If you see 1 bar, it's going to be positive, which means fentanyl or any of the other substances are in the drugs. If you see 2 bars, it's a negative test and there's no contamination. Now, you can get an invalid test. If you see a 1 bar that is farther away from the blue slots, then that is an invalid test and you're going to have to redo it. If it is a 1 bar close to the blue slots, that is positive and the test is valid and good to read.
Signs and symptoms of opioid overdose. Mild to moderate overdoses could be described as lethargy or overall unresponsiveness or unconsciousness, pinpoint pupils, decreased blood pressure and pulse, flaccid muscles, and cold and clammy skin. Severe overdoses could be described as a patient in a coma, respiratory depression, apnea, or seizures. What to do if you suspect an opioid overdose. Try to wake up the victim. This may require a sternal rub. Call 911 if they are truly unresponsive. Administer naloxone. Check patient for breathing, and if the patient is not breathing, begin CPR if properly trained. If CPR cannot be done, roll the person on their side to prevent choking. Assess if person needs additional dose of naloxone, and stay with the person until help arrives.
Step 1, call 911. Step 2, tilt their head back. Step 3, hold the nasal spray with your thumb on the plunger and place the tip of the spray in either nostril until your fingers are touching their nose. Step 4, firmly press the plunger to ensure entire dose of medication is released. Step 5, wait 2 to 3 minutes. If the person is still unresponsive, administer a second dose, switching nostrils. Repeat until medical help arrives.